Give it up for Dr. Butch Rosser right here.
Right.
Come on, Dr. Butch, let him hear it, guys.
How y'all doing? How are y'all doing out there? Well, y'all doing better than me. I feel like a chocolate ping pong ball right now. In the last 4 days, after leaving the operating room in Orlando, I have been on the West Coast 3 times. Now you add that up, and then I'll give you a master's in education because it has been crazy. But I'm so glad to be here with you today. And I want to say, I know y'all looking at me and saying, what that big black guy doing over here? Now I know I do not project the silhouette of a physician because I'm 6'4", 300 pounds, and that's where I'm stopping. And I suffer from offensive lineman's disease. I have no neck. So you would not naturally look at me and think I was a world-class surgeon. A lot of you see me on CNN, CNBC, talking about the cutting edge of medicine and how we're operating in the jungle, and you've seen some of my Discovery Channel things. But I'm proud to say I was professor of surgery at Morehouse for 6 years. I love the ATL. I love the ATL, and I am so glad to be back. 2 years removed down to the land of Mickey, and we're at Celebration Hospital, which was the dream of Walt Disney. And I tell you, I walk in happy and thanking the Lord every day. All right? So even though I don't look exactly like him, people have called me the Chocolate Oz. I started with Oz a long time ago. I subbed for him on Tom Joyner. They didn't put me in jail. So then they asked me back again, and I still stayed out of jail. Then I was on his show. Some of you all may have seen the show with the weight loss. I used to be 460 pounds. And like I said on the show, I'm a big unit still now, but I'm a healthier big unit. And thank you. So today, I am ticked off, and I have declared war against heartburn and war against gastroesophageal reflux disease, or GERD, and war against esophageal cancer. And you look up here and see this big man, you do not want him pissed off, all right? So the heartburn, it's going to have some trouble. Now, you got to be wondering, why is this guy in such a fervor over this? And see, it all starts with your heart. See, if you know my why, then you'll understand. And here's my why. My uncle Ludi Mitchell Jr., Uncle Dick. When I was a senior medical student, and I was at the VA, on Monday mornings you come in and you get your new patients. So it's Monday, right? So I'm rolling in there like a lot of y'all. You just barely there. So I'm in the back and they're going through checkout and they said, Butch, and I said, yes, okay, yes. I was dozing. It was an interesting weekend that weekend. And they said, well, you have your new patient, and his name is Mr. Ludi Mitchell, and he's from Scott, Mississippi. And I said, what? Mr. Mitchell has esophageal cancer, and that Mr. Mitchell was my uncle. You've never taken a longer walk than I did when I walked into his room, and I looked at my Uncle Dick. And I was walking down the corridor, you know what was going through my mind? Those times at the dinner table when he'd say, boy, go get me Tums. Boy, go get me Alka-Seltzer. The times he would hit his chest. And I said, Uncle Dick, what's wrong? Oh, it's a little heartburn. Well, my uncle thought he had a little heartburn, but in reality, my uncle had a big problem. It is true He was a heartburn sufferer, but he was more than that. He was a gastroesophageal disease hostage. And finally, as his doctor for 6 months to watch him die with nothing I could do, he was an esophageal cancer victim. Those of you out there today who have Uncle Dick's and Aunt Sally's and your father and your mother and your auntie who's doing the same thing, you have to ask yourself some questions today, and you have to get some answers. Because you don't know what you don't know. And what you don't know can hurt you. Can y'all say this again with me? Okay. You don't know what you don't know, and what you don't know can hurt you. This is why we got to fight this battle. There's sick people having heartburn every day, and only 20 million, 19 million getting diagnosed. And did you know this problem is getting worse? 22% of the visits to primary care physicians, guess what it's for? Heartburn. This is an increase of over 46% in 7 years. And then we're going over the counter and buying these medicines, the purple pill, and we're eating them and eating them and eating them. $20 billion worth. That's a whole lot of purple. Prince would fall in love. Now, the first question Dr. Butch is going to ask for you and answer it. That's right, I'm not crazy. I'm going to ask myself a question, and I'm going to give myself an answer. So y'all just enjoy the show. What is going on when you have heartburn? Don't you want to know? This is what happens. So you go down, that's your food pipe, the esophagus, and you're going on down. And you see how that green stuff keeps coming up? And that LES is supposed to be on the job protecting you. That's a valve that's supposed to stop that acid from happening. But when you have GERD, it ain't doing its job. It's asleep at the wheel. And that's the problem. You get the heartburn because the acid is coming in the wrong place. That's what's going on. Now, when you ask me, well, Dr. Butch, what is the difference between heartburn and this thing you are calling GERD? Well, this is the difference. It's frequency. Everybody has a little GERD, right? Half of y'all who cook that coleslaw and your kinfolk eat it, they're out there having GERD after they do that. They're having reflux, rather. They're having reflux. But a little heartburn and a little reflux isn't bad. But when it's getting you every single day of your life, as they say down in Mississippi, child, something ain't right. Ain't right. Now, I'm sorry, because 10 years I was a professor at Yale University. I mean, I've been there, but y'all are my home folk. I'm at home. Something's not right. So, well, Dr. Butch, how can I tell when things aren't right? Well, this problem has two different faces. Let me talk about the two faces of GERD. You got the typical symptoms. These are the ones everybody know about. Burning sensation in your chest, like my Uncle Dick. You swallow your food and, ooh, it's sticking. Then you regurgitate the food. Oh, that can ruin a first date. And then you got burping and nausea and bloating. Now, men, we don't care about that. But you women, oh, God, you gone to hell. Because y'all don't deal with this very well. Now, we don't even worry about it, but you don't. But this is some of the typical symptoms. Chest pain, and you got something that's in your throat. It feels like a ball. And, you know, you clear your throat, and it doesn't want to go away. You get up in the morning, and your voice, you sound like a frog. You know, you scare your husband and your wife because your voice don't sound right. Nobody knew the exorcist was going to sleep in the bed with them that night before. Then you get up on Sunday morning going to church, and you're supposed to sing the solo, and you're running out the door because you can't even hit a note. This could be a sign of acid reflux bathing your vocal cords. All right? What happens if it goes untreated? Well, it can be bad. If it goes untreated, this is what's going to happen. You can get bleeding. You can have scarring. You have all these bad things, including Barrett's esophagus. Now, Barrett's is important because that's the beginning of cancer. You don't want what's on the left to go to what's on the right. Because just like Dr. Oz did a show, and the producers did a great job, esophageal cancer is the fastest growing cancer in the U.S. Now, how do you know whether it's simple heartburn or GERD? The message is you must get evaluated. That's our message today. Because prevention is the key. Getting an early diagnosis and seeing if the medicines are right or surgery is right. Now, what are the tests? I want to show you these tests, and don't be scared. A lot of y'all know you're scared, all right? Now, this is the endoscopy. You should not be afraid of endoscopy. We give you a little medicine. We go on a journey in your body, okay? And we'll get an answer. Also, you got to know your number. We can actually tell you how much acid is exactly coming back. And here's a special sensor we can put down into your esophagus, and it sits there for 2 days, and it can tell us what's going on. Now, we can tell how weak that door is by doing this test. See that little catheter going down? It can tell us exactly how strong or weak it is. Now, what are some of the things you can do? Well, first thing, lifestyle changes will help most of us. Not elevating the bed with pillows, but actually lifting the bed up, changing when we eat, what we eat. Here are the good, here are the bad foods. All the stuff you know we had, like I had some alcohol last night, caffeine, chocolate, carbonated beverages, canned foods. Canned foods have all that acid in it. Then you go get a Whopper with the onions and the tomatoes. All that makes the door weak. Then you're going to throw a mint down there and make it worse. And garlic, oh, help us, Almighty Father. Get those grilled foods. And I'm going to go through this because we're short on time. But I wrote an article for Oz. You go there and I'll tell you all the good stuff you can do on your own. But when they don't work, you can do pills. But the pills, don't you try to treat yourself like my mama. You know, you ain't no doctor. Go to the doctor and let them evaluate you. Like I tried to tell my mama she had gallstones. She said, boy, you don't know nothing. I said, mama, you sent me to school, mama. You sent me to school. You don't know anything. So the PPIs can work, but under a doctor's care, all right? Don't medicate yourself acting like my mama. And then when that doesn't work, there's some surgery stuff. Now, you don't want my big old ham hocks for hands going inside your body like this. So that's why I do the little bitty surgery. I play video games, those long things. And that's why I don't want you to fear it. And we can either fix it like this and put a little reinforcement around that valve that's weak, or we can do this. We can put a bracelet around it. We can put a bracelet around it. And here it is. I want to show you this because this is a miracle. This is called the Linx anti-reflux system. And it can come in and it can bring in those little magnetic beads. You put it around that valve and look what happens when it goes around. It stops that green stuff from coming back. It's more natural than anything I've done. And when you swallow, watch what happens. Booyah. That's what I'm talking about. So, now if you get that Barrett's esophagus, that B word, and I ain't talking about the other one y'all use down here, just look at Atlanta Housewives. I'm not talking about that. Y'all can come in. I know I don't like them either. But anyway, this is how you can use that radio frequency to get rid of that Barrett's and stop that cancer at the door. So now you got some great doctors as I close, Dr. Waring and Dr. Smith. They are here. You get their cards because they could operate on me. And also, we got to get your primary care on board, and we got 2 that do it. And Dr. Butch is going to lead you with these 4 things. We call them in my house the BRQs, Butch Rosser quotes. Here it goes. Now, y'all help me. All heartburn is not created equal. Okay? And because you could have GERD, right? Let's go with the second one. GERD is not a good thing to have. The third one, don't self-medicate. Get yourself a checkup date. And finally, don't be a dope and get scoped. I want y'all to listen to me every Wednesday on iHeartRadio 104.1, and the doctor will be in. Just ask Dr. Butch, and we're going to be GERDs. Thank y'all, Atlanta. Bye-bye.
A big hand for Dr. Butch right here.